So this is our third, although skipped over the second in our three-part series of confidence in health. And we're so grateful to you guys for putting this together. And tonight's lecture is about dementia. So Dr. Nina, if you want to tell us about yourself and go ahead and tell us about yourself and start with the lecture. Sorry, I'm a little rusty on this Zoom thing.
I know. No, that's okay. Same. Yeah, I'm probably just going to be like looking back and forth so I know my slides are appropriate. But thank you.
Happy to have you, and we really appreciate you doing this for us.
Yes, no problem. Thank you for inviting us. So yeah, I am an internal medicine physician. I practice in the outpatient setting, in a traditional outpatient medicine setting. So I see a bunch of patients with a host of medical issues. And then I'm also part of Columbus Prevent and Reverse, which is essentially a team of doctors who use lifestyle modifications and diet in order to prevent and reverse disease. Our goal is to basically to get patients off medications ideally, or at the very least decrease their medications and improve their quality of life using lifestyle modifications. So today we're going to talk about dementia because it's such a big deal. And basically the way the lecture is kind of oriented is we'll talk about some basics about dementia. I just want you to kind of have an idea of the treatments and things like that. And then we'll also kind of talk about some lifestyle modifications that can be made. So hopefully this works here. You know what? Hopefully it doesn't require me to, oh wait, perfect. I think the title slide was just okay, or was just off. So dementia, like I said, is a big deal because it's the leading cause of death for people 65 and over, the fifth leading cause of death, I'm sorry. It affects many parts of the brain, but those specifically responsible for our thoughts, our memories, our independence, our language. It can interfere with our daily function. It can essentially take away our independence that we have. And it's a progressive disease that's usually associated with gradual changes. The problem with dementia is that it's irreversible and there's no cure for it. So the most common type of dementia that we know of is Alzheimer's, and it is responsible for 60 to 80% of cases of dementia. So there's no known cause in regards to the etiology of Alzheimer's disease, but there's a lot of research being done to see if there are any specific links. But at this point, we really don't know of a specific cause of Alzheimer's. The problem with Alzheimer's is it eventually leads to an inevitable progression of disease in essentially every single patient. There are other types of dementia as well, and really today we'll concentrate on Alzheimer's and vascular dementia. Vascular is the second most common cause of dementia, and it's usually associated with a stepwise deterioration or a stepwise progression of symptoms. So essentially there are very abrupt changes in the cognition that can occur over time. It's typically associated with like a post-stroke dementia. By the name vascular dementia, we know it's when there's a compromised blood flow to the brain, basically. So a stroke is like a heart attack to the brain. And so vascular dementia can occur in those who have had strokes, or maybe even in those who have had very tiny strokes that did not cause like a clinically big picture, but it's accumulated over time causing dementia. And vascular dementia is extremely pertinent. It's, of course, the second most common dementia, but we know that a lot of people in this country, in America especially, have a lot of vascular disease risk factors. And those risk factors are things like hypertension and high cholesterol, obesity, and diabetes. So it's definitely a prominent cause of dementia. And then there's a couple others like dementia with Lewy bodies, frontotemporal dementia, and Parkinson's disease. But we're not going to get into those today, just because I want to concentrate on the most common forms. There's also something called mixed dementia, which is essentially a combination of Alzheimer's disease plus vascular dementia, and this is not good. So when patients have underlying cerebrovascular disease, which is like a stroke-like picture, lots of vascular risk factors like I talked about, and they also have Alzheimer's disease, it really makes for even worse cognitive performance. So that is definitely not a good thing. So first, we're going to just talk about mild cognitive impairment. And this is the intermediate stage. So this is a stage before overt dementia develops. It's extremely, extremely common. Typically, people with mild cognitive impairment have a preserved ability to function. So they may or may not even realize that they have mild cognitive impairment. It's typically a precursor to and represents an increased risk to overt dementia. And really, there are no specific medical treatments for mild cognitive impairment that have been proven. The amazing thing about this, though, is that it's potentially reversible. So I wanted to talk a little bit about how dementia often presents, and maybe most of you kind of know this, but of course, memory loss is a huge factor in the presentation of dementia. Patients often also have an impaired executive function, and executive function is basically the things that we need in order to pay attention or remember information or multitask. Patients often present with reduced insight. Typically, it's the spouse or family member that's complaining about a patient's memory loss, and they're the ones that come to you. My husband's actually an ER doctor, and he always talks about the fact that during the holidays, there's always a spike of dementia. And it's because all the family members of a patient are coming to visit a patient during the holidays. And that's when they realize that mom or dad or grandma or grandpa have significant memory loss. And so they take the patient to the ER. And so there's all these holiday diagnoses of dementia because of that. And then the other symptoms that can present in this setting of dementia really kind of depend on the stage, but they can include behavioral symptoms, psychologic, sleeping issues, apraxia, which basically means forgetting a learned behavior, like forgetting how to use a fork or walk. There are stages of dementia, Alzheimer's in this case that we're talking about. And so it really depends on what stage someone's in, like I said. So one thing to remember is that brain changes related to Alzheimer's start 10 to 15 years before the onset of symptoms. And so I just quickly wanted to run you through the stages of Alzheimer's. So you have the preclinical stage, which again does not manifest as any symptoms. And after that stage, we may start to get some basic forgetfulness. So just little things like maybe I can't think of a name, or maybe I lost my keys. I don't know where my keys are at. I'm not saying that every time you lose your keys, you should be worried about dementia, because if that's the case, I would have had dementia since I was 16 years old. So know that these changes are consistent in their baseline. So after that very basic forgetfulness, the next change would be, or the next stage would be noticeable memory loss. So the same thing, like difficulty finding words or difficulty remembering things. But at this time, because it's a little bit more advanced, it may present with challenges at work, or maybe your family members may start to notice that. And then after that is more than memory loss. So basically people forgetting what, or not knowing what time it is, where they are. People might have issues with wandering or getting lost. They may be more withdrawn at social gatherings. After that, the next stage would be a decrease in independence. So basically, you're concerned that maybe your family member is not safe to live at home. You're worried that every time they microwave their food, they're going to burn the house down. So that's the next stage, which is where they lose independence. A lot of times these people also may have issues with paranoia or hallucinations, and that also represents a further progression of decline. And then eventually patients start to have really severe symptoms where they have trouble communicating, they can't do basic tasks. And if that progresses, essentially the sad and last stage of this would include like a lack of physical control. So it's the stage where patients are needing 24-hour care. They can't walk by themselves, they can't sit, they can't even swallow properly. And so those patients are often at risk to have infections. And that's honestly such a big part of the mortality risk of dementia, is the risk of infection. So that's typically how it progresses. So the treatment, like I was kind of stating earlier, so there's no medicinal cures for dementia, and that's what makes this really, really difficult. There are some medications or treatments, medical treatments, and these treatments may help potentially with the symptoms, but really it's a modest benefit alone. There's really no evidence that our current treatments are actually neuroprotective, and really there's nothing to suggest it can alter the disease trajectory or the future of disease or the progression. Ultimately, I mean, the treatment or the disease is fatal, and that's the unfortunate part. I wanted to quickly touch on the new treatment that recently was rushed approved by the FDA, and it's the Aduhelm. I've heard multiple ways to pronounce this, but it's the brand new treatment for dementia. It's the newest drug. Like I said, it's a monoclonal antibody. It's a bit controversial. So essentially, the mechanism of action of this antibody is that it binds to the plaques in the brain that are associated with Alzheimer's. And it's thought that the plaques in the brain are what destroy the brain eventually. So the thinking is that this antibody will bind to those plaques and then activate our immunity to destroy that plaque and monoclonal antibody combination, which will then destroy the plaques and prevent the further damage to the brain. The problem is it's not really proven. Like I said, it's brand new. There's a lot of controversy, and that's because there are, some significant side effects, including swelling of the brain or brain bleeding. The treatment duration is forever, like you have to be on this forever. It costs, I think, something like $56,000 a year. It can only be used in early stage Alzheimer's disease. And out of the 2 major clinical trials that were done for this antibody, only one of them showed benefit. So I kind of look at it as there's still no treatments for Alzheimer's, unfortunately. But I just wanted to kind of touch on that. So with all of that said, that's a little bit grim of a conversation, but hopefully you can see why prevention of dementia is such a key issue. So the Alzheimer's Association and the World Dementia Council have reviewed all of the evidence, and they state that there are modifiable risk factors that can help prevent cognitive decline and dementia. They said there is sufficient evidence that supports the link between regular physical activity and management of cardiovascular risk factors, so diabetes, obesity, smoking, high blood pressure. And management of these risk factors can reduce the risk of cognitive decline and dementia. And they've also found strong evidence that having a healthy diet and participating in lifelong learning can also reduce the risk of cognitive decline. And so that's what I really, really want to talk about, because that's what we have in our control. So real quick, a couple non-modifiable risk factors are our age. So anyone 65 and older has a higher chance of dementia. We know that the risk of Alzheimer's dementia doubles every 5 years after age 65. Our family history also plays a role in this, and obviously we don't have control over that. And then there are potential genetic mutations that can also increase the risk of dementia. So those are non-modifiable. But the good thing is we have at least 12, actually a few more than that, proven modifiable risk factors that can reduce the risk of dementia. The amazing thing is that these risk factors can reduce the risk of dementia by 40 to 60%, which is obviously a lot. The cool thing is the more of these risk factors that you eliminate or work on, the lower the chance you have of Alzheimer's. So if you incorporate 2 or 3 of them, you can decrease your risk by 37%. And if you incorporate 4 or 5 healthy factors, you can reduce your risk by up to 60%, which is, again, incredible. So they kind of break up these risk factors into early, middle, and late life. So a couple of factors that can increase the risk of dementia in our early life are having a lesser amount of education. So they've proven that having higher education and a longer lasting education can significantly increase cognitive performance and decrease the risk of dementia. And this also includes having like a low job complexity. So a very simple job can increase the risk of having dementia as a young person. And so the reason for this is just because having more education or higher education leads to a higher cognitive reserve. And what that is it's the time it takes for our brain to manifest the changes of dementia in our everyday life. So if we have a higher cognitive reserve, it takes a lot more for our brain to actually manifest in, a lot of forgetfulness or cognitive decline. So those are early risk factors. So midlife risk factors. So one of the huge ones is hearing loss. So people with moderate to severe hearing loss have a 5 times higher risk of getting dementia. So in addition to protecting your hearing, so obviously avoid exposure to extremely loud sounds. If one already has hearing loss, getting hearing aids is so important in reducing the risk of dementia. And that I know can be difficult for a lot of patients because they don't want to accept the fact that their hearing is going down, but it is so protective for dementia. The next is a high blood pressure or hypertension. So having a systolic or top blood pressure number greater than 130 is a huge risk factor for dementia. And that's because hypertension or high blood pressure is the primary risk factor for the brain vascular disease or the brain blood vessel disease that we were talking about earlier. Being obese increases the risk of dementia by 50%. Alcohol, an excessive amount of alcohol intake can lead to an increased risk of dementia. The toxins in the alcohol can directly damage the nerve cells in our brain. And added to that, alcohol also increases our risk factors for the vascular disease. So we know alcohol causes obesity, increases blood pressure, cholesterol, it increases our risk for diabetes. There's really no protective amount of alcohol that we can consume to protect ourselves from dementia. So you may have seen or heard before that they used to say, or that they said, drinking too much alcohol can lead to dementia and drinking too little alcohol can lead to dementia. That latter statement is complete garbage. So what happened was the studies did not distinguish patients who never drank a drink in their life and the patients who just stopped drinking. And what the difference is that many patients who stop drinking do so because they are so ill that they have no other choice other than to stop drinking. And so the studies didn't take that into account. And so what it caused is a bias towards the fact that people who stop drinking get more ill, but that's not true. They stopped drinking because they were already very ill. So I like my wine myself, and I would love to find anything that proves that it's good for you, but just know that there's no safe level of alcohol to consume for the risk of dementia. And then lastly, having a head injury in the midlife stage can lead to an increased risk. And now some later in life risk factors that we can modify that can increase the risk of dementia. So smoking. Although I would argue that smoking at any point in time is harmful for our health. Definitely smoking can increase the risk of dementia. It can cause atherosclerosis or the buildup of cholesterol and plaques in our blood vessels, including the ones in our brain. Smoking causes inflammation to ensue throughout our whole body, including in our brain. And we also have to be careful about secondhand smoke exposure because that can also lead to dementia. The next thing is depression. So having a high amount of depression or high stress levels essentially can increase our cortisol levels in our body, and that can lead to hippocampal atrophy, which is essentially a shrinkage of our hippocampus, which is the part of our brain that's responsible for memory. And so this can also lead to dementia. The next thing is social isolation can very much increase our risk for dementia. So COVID's not great for dementia. The next is physical activity. Inactivity is associated with a 35% increased risk of dementia. And that's because if we are inactive, that alone can decrease our hippocampal volume and total brain volume. And again, that hippocampus is what's responsible for memory. They say that even the ideal exercise regimen is 150 minutes of aerobic exercise plus weight training every week. But the studies have shown that even two 20-minute sessions of exercise a week can be extremely helpful for reducing our risk of dementia. Diabetes also can increase our risk, and then air pollution, interestingly enough. So traffic fumes, one of the worst exposures to traffic fumes is sitting in your car in crowded traffic or burning wood in your house. That can actually lead to the development of dementia through a couple different mechanisms, but one of the it was a study done in 2021, essentially just showed that particular particulate matter exposure that's in pollutants essentially causes direct damage through our brain through oxidative stress, and that can increase dementia risk. So they said that just reducing emissions may lessen the burden of dementia worldwide. And then a couple other things that we can potentially link to development of dementia. So taking long-term medications, certain medications can increase our risk. And those medications are benzodiazepines like Xanax or Ativan, you may have heard, anticholinergic medications, even Benadryl, taking that for a long amount of time can potentially lead to dementia. And then even certain opioids can lead to that as well. Not having enough cognitive activities, so a decreased amount of cognitive stimulation can cause dementia in any stage of life. So it's so important, even in like later stages of life, to learn new skills and play board games. So keep your mind mentally active. That's actually truthfully helpful for dementia. We've also found that a decrease in sleep is associated with dementia. So several studies have showed that people who sleep for 6 hours a night or less in their 50s or 60s are much more likely to develop dementia. And most people that I know think that 6 hours of sleep is a nice chunk of time, but it's actually not. We really want to focus on that 7 to 8. And then lastly, meditation. So there has been research suggesting that meditation can improve cognition and outcomes in those with early, cognitive decline or overt dementia. There's actually multiple studies that have looked at the links between meditation and dementia. One recently was done at the University of Pennsylvania, and they essentially had patients with early cognitive decline do a type of meditation and yoga for, I think they did it for 8 weeks. And after 8 weeks, they noticed a significant reversal of memory loss and also reduction of anxiety. And both of those two things are hallmarks in Alzheimer's disease. So that's pretty incredible. So next, I wanted to talk about one of the most important factors that you can modify in order to decrease your risk of dementia, and that is diet, or our food, the types of foods we're eating. So consuming a whole food plant-based lifestyle. So whole plant-based foods are essentially foods that are high in fruits, vegetables, legumes. They're naturally low in fat. They're devoid of animal protein and devoid of processed and refined foods. That type of lifestyle can prevent and reverse many chronic diseases. And there's evidence that dementia can be prevented by incorporating a whole food plant-based lifestyle. And there's even ongoing clinical trials that are trying to prove or determine if consuming a whole food plant-based lifestyle can actually reverse dementia, which again, we don't have anything else that could do that. So whole plant-based foods are naturally rich in antioxidants, and these antioxidants can decrease oxidative stress, which end up decreasing inflammation everywhere. So throughout our body, and including to our brain. So we can decrease our neuroinflammation by incorporating whole plant-based foods. These types of foods can also prevent and reverse essentially every single vascular risk factor that I mentioned. So hypertension, diabetes, high cholesterol, and obesity can all be prevented and reversed by incorporating a whole food plant-based lifestyle. One of the other amazing things about this type of lifestyle is there's proven literature showing that whole food plant-based lifestyles can actually reverse aging by lengthening telomeres. So there's actually an article in the Lancet, which is one of the most reputable medical journals, and that article is titled "Reversing Aging at the Cellular Level." And what this study proved is that telomeres are actually the caps on the end of our chromosomes. Our chromosomes house our DNA. So our telomeres are like the little cap at the end of our chromosomes that protect our chromosomes from degenerating. And the incorporation of a whole food plant-based lifestyle can actually lengthen our telomeres. And typically with time, just typical time, our telomeres will shorten, and so we get less protection to our DNA. And we know that the more DNA damage we have, the more risk we have of developing chronic diseases and death. So the fact that we can actually lengthen telomeres and give our DNA better protection is incredible, and that's all accomplished by diet. The only two things that have ever been proven to reverse aging like this are incorporating a whole food plant-based diet and meditating, both of which, can also, of course, help prevent dementia among other chronic diseases. I always talk about the fact that we're always looking for a miracle pill in medicine. We're always trying to find that one thing, just take that one thing, do that one thing, and it'll take care or reverse every single medical issue that we have. And the reason we're looking for that is because we're sick of taking one medicine that hurts us in other ways. So, our heart medication helps with our heart, but then it destroys our kidneys, or the chemotherapy kills the cancer cells, but then it kills all the good cells too. And the thing I always say when I'm talking about this type of diet and lifestyle is that we live in 2021 and we have self-driving cars and robotic lawnmowers, but we're still at a point in medicine where we have to choose which organ we want to save. And that just doesn't make any sense. The fact is, incorporating a whole food plant-based lifestyle is the miracle pill. It literally can help with virtually every single medical issue, whether it's prevention of disease or likely reversal of most diseases. And it does that without hurting any other organs in our body. So a couple of standout foods that I wanted to kind of touch on in regards to dementia. So the number one food that you can consume to help with dementia, in addition to just eating fruits and vegetables, so green leafy vegetables, specifically cruciferous vegetables. So that's broccoli, kale, collard greens, Brussels sprouts, cauliflower, and also spinach. And it is because they are high in lutein, which is essentially a phytochemical or a plant chemical that can help prevent dementia and help protect our brain. People classically say that eggs are really high in lutein, but just a half a cup of kale has 50 times more lutein than an egg. So it's better to eat your leafy greens. Berries are also extremely important in helping fight dementia, among other health issues. Nuts are very good for your brain, especially walnuts are one of, if you had to pick one nut, I would say eat a walnut because it's very, very good for your brain, but it's also the nut that has been most associated with decreasing our cancer risk. Foods that can cause a rapid cognitive decline or rapid, onset of dementia. So standard American diet, unfortunately. So the diets that are high in meat, especially red meat, that's one of the worst. Diets that are high in the high fat dairy components, things that are high in refined sugars, of course, fast food, fried food, just processed foods in general. These types of foods are very, very high in saturated fat, and that is one of the worst types of fat to consume. That is what causes inflammation throughout the body. Again, not just dementia, but cancers and heart disease and all of the stuff we're trying to prevent. Also, foods that are very high in salt, which again are typically the standard American diet, those foods can increase the protein tau that's found in patients with the brains of patients with Alzheimer's. And then lastly, I wanted to just quickly touch on a couple of nutrients and supplements that have been associated with potentially protecting the brain from dementia. Know that there's ongoing research that's needing to be done for this. And so they're still trying to sort out like the benefits of these types of supplements, but we'll kind of talk about a couple of them. So the first one is turmeric. So I'm going to jump to the next slide here. The American Journal of Geriatric Psychiatry actually published a study. It was a randomized controlled trial that showed that turmeric, which is that yellow spice that stains all of our white clothes forever, that supplement can lead to significant improvements in memory and attention. They did pre and post imaging of the brain in these patients who received turmeric, and it showed that there were decreases in the formation of plaques in the regions of the brain associated with mood and memory. And the mechanism of action that we think is essentially turmeric is extremely anti-inflammatory, and that's why it's also known to help protect us against other issues like cancer and heart disease and even joint pain. And we think that the turmeric potentially decreases the oxidative stress on our body, and it has anti-amyloid effects. And amyloid is that protein that develops the plaques in Alzheimer's. And because of that anti-amyloid effect and the anti-inflammation that occurs with the turmeric, we think that that's what's protecting the brain from degeneration. Now, turmeric is very temperamental in regards to the absorption. And so not all formulations of turmeric are well absorbed. And that might be the reason that some studies are not seeing any benefit in dementia with supplementation of turmeric, because of the lack of absorption of some turmeric. So some types of turmeric. So the best way to consume it, assuming you don't have any issues or any medication interactions, I always recommend that patients do 1/4 of a teaspoon of the yellow turmeric spice. I highly prefer the spice over the supplement. I think that in general, we for most every supplement, with a couple exceptions, which I'll mention, we absorb and digest minerals and supplements much more when we're eating them. So 1/4 of a teaspoon of that turmeric powder, you can mix it in a little bit of water. It does not taste good when you're consuming it plain, but you can take it like a shot and take it right before you eat a meal, and make sure there's a tiny bit of black pepper on your meal. And that's because the black pepper significantly increases the bioavailability and the absorption of the turmeric in your body. And it, again, has so many protective effects, not just for dementia, but for other medical issues as well, including immunity as well. So my husband and I do a turmeric shot every single night before dinner, and he does not enjoy it, but he's getting used to it. So I highly suggest it. The next supplement, well, this is more of a dietary change, but flaxseed. So ground flaxseed has a very beneficial omega-3 to omega-6 ratio. A lot of people try to accomplish this benefit by taking fish oil supplements. It's not the same. You got to eat the flaxseed. So my recommendation for flax, you can find it on Amazon or in a lot of grocery stores. I'll tell people to do 2 tablespoons of ground flaxseed in their food every single day. It has to be ground for you to absorb it, and you have to store it in your fridge or freezer. Otherwise, it can go rancid. And not only, I keep saying this, but not only does it help with dementia, but as I said, a lot of these things help with other issues. It helps decrease blood pressure and cholesterol and diabetes, and prevents many different types of cancer. I think flaxseed is best when mixed in something like a thicker liquid or a thicker substance. So like oatmeal, I think is the best, or you could do it in smoothies or things like that. And then there's some evidence showing that low levels of B12 and folate can produce a clinical picture that's similar to dementia. So ensuring that your levels are normal are going to be a good thing if someone ever presents with memory loss. Folate is found through whole plant-based foods, so you're good there. When it comes to B12, so that's one thing that's more commonly present in animal-based foods. However, if one was to go 100% plant-based, they can get B12 either through the fortification of certain foods. So certain foods that are plant-based are fortified with B12, or they can consume something called nutritional yeast, which is a plant-based product. It has like a Parmesan cheesy type of texture. I think it tastes really good in a lot of different food. I personally will, because I'm not good about taking medications or supplements, I'll use a couple tablespoons of nutritional yeast in my food throughout the week. It's good in savory food specifically. And my B12 levels are, if anything, super therapeutic with that. And then lastly, if you can't remember to take a B12 supplement and you're eating whole food plant-based, or if you can't remember to take the nutritional yeast, you can take a B12 supplement. And then vitamin D, there's some weak evidence suggesting that this may increase the risk of dementia if the vitamin D levels are low. This is one of the few supplements, this in addition to B12, that I do believe in supplementing with if you're going to take something. So vitamin D is a fat absorbed vitamin and it has extremely minimal risk. So even though there's questionable benefit in the setting of dementia, because it has other benefits in regards to immunity, cardiovascular disease, it can reduce the risk of development of multiple sclerosis. I think everybody should take vitamin D. The only caveat would be someone who's maybe had kidney stones in the past. And so taking a daily vitamin D supplement is really beneficial for more issues than just dementia. And then lastly, there was some research in the past stating that vitamin E supplements, so high dose vitamin E supplements, could help prevent dementia. I feel it's extremely unsafe to take a vitamin E supplement because there's actually a correlation between high dose vitamin E supplements and an increase in mortality in patients with a history of cardiovascular disease, which in America is a lot of people. So instead of taking a vitamin E supplement, just eat nuts because nuts have vitamin E and they're not going to kill you. So I always tell people to consume those. So those are kind of the main points that I have to talk to you about dementia. If you can only remember a few things, you can remember for dementia my favorite quote by Dr. Dean Ornish, and that is to eat well, move more, stress less, and love more. Thank you.
I love that. I love that quote. Thank you so much. I was just going to ask if there were any questions as well. I do have a question.
Yeah.
Before we open up to everybody else. Sure. You talked about vitamin D. How many units do you suggest taking?
Good question. So it really, I suppose it depends on the person. In the general population, taking 1,000 to 2,000 units of vitamin D3 daily is effective. The therapeutic dose or the therapeutic range of vitamin D is between 40 and 60, which is pretty high. The normal is anything over a level of 30, but actually studies have showed that a level of 40 to 60 is actually more beneficial. And it takes a lot of vitamin D to get over therapeutic. So in general, 1,000 to 2,000 units. And I, of course, because I believe in plant-based eating, you can find many different plant-based vitamin D supplements on Amazon. So just keep that in mind because a lot of them have animals in them.
Okay, thank you.
Yeah.
Anybody else have any questions?
Yeah, I just wanted to say, thank you for the lecture. I've learned so much in like literally a very short period of time. I was wondering, what was the dose of like the flaxseed, the ground flaxseed that you recommended? Was it 2 tablespoons or?
Yep. Yeah. 2 tablespoons of ground flaxseed. Yep. Every day.
Great. Thanks.
Yeah. Thanks.
Anybody else? You're so thorough that nobody has any questions.
Thank you.
Yeah, I have a question regarding the turmeric. What was the recommended dosage for that?
Yeah, so I typically will recommend 1/4 of a teaspoon of the ground turmeric. Now, some of the studies, and again, there's still a lot of studies being done. I know some of the studies recommended a higher dose, like a half teaspoon to a full teaspoon, which is quite a lot. So I tell people to start out with 1/4 of a teaspoon daily. And again, you know, because I'm in internal medicine and I see patients who are on many medications, I always tell them to of course, make sure that there's no interactions. One of the biggest things with turmeric is if someone is on a really potent blood thinner like Coumadin or Plavix or Xarelto, they just have to be careful with turmeric, as it can sometimes have like a slightly thinning blood component, specifically in the setting of taking other blood thinners. In general, that's more prominent when it comes to the turmeric supplement as opposed to the spice, which is what I'm recommending. But I always like to kind of give that disclaimer.
Thank you. That was
Yeah.
good.
And with a pinch of black pepper, if you didn't already get that. Any other questions?
I had a question. You mentioned that there's such a thing as Parkinson's dementia.
Yeah.
And does everybody with Parkinson's get dementia, or how is it?
That's a good question. Not everybody with Parkinson's gets dementia, but it's a type of dementia associated with Parkinson's disease. So yeah, not everybody develops that, and it's a little bit different of a pathophysiology and course as the Alzheimer's or vascular dementia.
Okay, thank you.
Yeah.
And as you're talking about vascular components, I saw that high blood pressure was a contributing factor. What about if it's regulated through medication? And I know that would be the preferred thing, not to have to do that, but the reality of it is, if it's managed through medication, does that decrease the risk factor?
Definitely. So I think, like you said, the most ideal is controlling the blood pressure without anything. But if I had to pick the next ideal situation, it would be definitely to decrease it with blood pressure. And I think that's a complicated thing with medicine. It works and we use it, and sometimes it's our only resort. But you know, one thing I just always think about is America is one of the unhealthiest countries out there, and we have access to so much medication. So definitely, if the blood pressure is high, yes, medication can decrease the risk, but not as much as fixing the diet, if that makes sense.
It sure does. Thank you.
Thank you.
One more question. It's about the turmeric. So
Yeah.
you only have to do it with one meal, not every meal?
You know, you can do it with every meal if you want to. I think that it's hard, at least in my experience with my patients, it's hard for my patients to consume more than 1/4 of a teaspoon each time, just because of the potent flavor. So if you wanted to get extra credit and take a little bit more, you could potentially split it up, or you could just put it all in one, you know, 1 cup of water. But I try to be realistic with my recommendations, and I don't want to tell people, you know, things that are going to make their stomach hurt or.
Well, I eat it every morning at breakfast, and I probably put between 1/4 of a teaspoon and 1/2 a teaspoon in my overnight oats, and then
Awesome.
I put another 1/4 or 1/2 a teaspoon with some flax seeds and ginger and
Good for you.
cinnamon and pepper, and grind it all up and put it over the fruit that I have with my power greens.
Good. Are you my patient?
No.
Awesome. That's awesome. Yes, that's great. That's very good. I think that's perfectly fine. Anything else?
Okay, well, I guess if nobody else has any questions, we thank you so much for your time, and we all, I can speak for everybody, we thoroughly enjoyed sorry, my dog's barking in the background. We thoroughly enjoyed your lecture and all the information. Thank you so much for taking the time.
Thank you all.
Speak to us. We really appreciate it.
Of
And
course.
we look forward, we're going to reschedule, everybody. We're going to reschedule
Yeah.
The cooking?
yeah, in January, when everything's behind us. Hopefully all the COVID is behind us.
Absolutely.
Yeah.
Yes, we can't wait for that.
Yeah. I know, we're excited too. So thank you so much.
Thank you. Thank you so much.
Thank you.
for coming.
Have a good evening, everybody.
Thanks.
Bye.
Bye.